Welcome to another exciting episode of Kevjet, the podcast. The viewers have spoken, and I've listened. This week's guest is Veterinary Surgeon James Eade.
Being a vet is not all cute puppies and kittens, but you know what? Sometimes it really is. Sometimes we just have a day of puppies coming through for their vaccines and stuff, and that's just ace because, you know, you can work with the families, you can see their joy and their enjoyment of what's going on too. And yeah, it's priceless. I love it.
We discuss all the right ways to adopt your new furry friend and puppy breeders versus rescuing puppies.
The phrase I often use is, you're not rescuing a puppy if you're parting with cash. The puppy dealers and the puppy farmers, they do just want one thing, and that is the cash, and they don't really mind how they get there.
It's not all dog talk. We also talk about our furry little kitties.
There's millions of cats in the UK that have arthritis that are not receiving treatment. So I guess that would be my biggest plea in this podcast, to say if you're a cat owner, have a look at your cat's lifestyle. And
I ask all the burning questions sent in by our listeners, and we also discuss end of life for our pets.
It's really important to me, you know, I'm a vet, I'm an advocate of animal welfare. It's important to me that the pet and the client, the family, get what they need out of those final moments. If we can't do that bit right, then we kind of need to take a look at ourselves.
Ladies and gentlemen, this week's guest, Dr. James H. Eade. Welcome to Kevjet, the podcast. James.
Good afternoon.
Good afternoon to you. I'm looking forward to this conversation. When I go out to my friends and to people on social media and ask who they'd like to hear from, the number one guest that they recommend is a vet at the moment.
Wow. Okay. I'm sure there's lots of reasons for that, and I'm sure we'll dive right in and get there.
Of course. So James is located up north now and has just opened his own independent practice called Millie's Vets.
That's right.
Do you want to tell us about that?
Yeah, so I've been a vet 23 years, and some years ago I did have a previous practice, and actually in the same town that I've just reopened in, and for family health reasons I chose to sell that practice about 11 years ago now. Since then I've done some locum work and some home visit work too, where I go to clients' homes, but the limit on home visit work is, of course, I can't do any surgery or x-rays or ultrasound scans and those sorts of things. So I had a little bit of a battle up here for a couple of years with the local planning authorities. We got there in the end. And I always said if ever I had my own practice again, that I'd name it after my first dog, who was Millie, who you actually would have seen, of course, a few times across the local park all those years ago. Sadly, she's no longer with us. The practice is there in her memory, I guess.
That's lovely. It's great. I remember her very, very, very well. She was a staple to the practice down the road from where I am.
Absolutely, yes. And the practice itself, we opened in January this year, so we're only, 7, 8, 9 months in, something like that. And as per reports worldwide, you know, we were inundated with clients, and lots of people got puppies and kittens during I guess the episode that we won't really mention, I guess.
No, we won't say that word.
No, of course. But, you know, loads of people have got dogs that are now 3, 4, 5 years of age. And, yeah, there's loads of work out there. And the practice is thriving, which is really good, providing jobs to the local people and much needed services in the local area.
That's amazing. And I've been watching it on social media, and I see that there are even some more vacancies coming up at the moment.
Correct. Yeah, absolutely. But like everybody else, you know, those vacancies will take some filling, I'm sure.
Why don't we start from scratch? There is your average person comes to you and says, I'm thinking about getting a puppy. What is your advice?
So first of all, I wish that actual question would be posed to me a lot more often, rather than we've just got our puppy and can we register, which is obviously great in its own right. But I am really passionate about trying to help people avoid the pitfalls of unknowingly buying from puppy dealers and also from puppy farms, and helping people to try and avoid getting into a situation whereby, you know, maybe we end up with a dog with behavioural problems and those sorts of things, which can stem right from those really early days, because early day socialisation is absolutely critical. back to your question, we're thinking of getting a puppy. If people out there listening to this are thinking of getting a puppy, reach out to your local vet and pose that question to them. But I'll give you my advice quite happily. And there's a few things that I would suggest to do and not to do. And one of the things not to do, if we're talking about a young family with young kids, the first time you go and see the puppies, please don't take the kids. Because if you realise when you're there that you've walked into a puppy farm, if the kids are there, you're not going to leave without a puppy. So first thing, the adults go, have a little look, sound things out. And if there's something you don't like, do be prepared to walk away. A phrase I often use is, you're not rescuing a puppy if you're parting with cash. The puppy dealers and the puppy farmers, they do just want one thing, and that is the cash, and they don't really mind how they get there. So do be prepared to walk away. But ultimately, you should be having quite a long conversation with the breeders. Hopefully this is a family-raised pet. It's a family who've chosen to have a litter of puppies, maybe as a family experience for their own family life, something to go through with the kids. Maybe it's a learning process for them. But it should be an animal that lives in the house, not in the shed. It should be, well looked after. And they should be asking questions of you as well. What's your working pattern like? Why have you chosen this particular breed? So it really should be a dialogue in those early days between the person who is providing the puppy and yourselves who are looking to get the pup. There's loads of homework to do, and the good thing is there's lots of information out there. We as a practice will happily provide information to people, and wherever people are listening to this right now, reach out to your local practice and ask them that question.
That is very important. I have 2 dogs, as you know. One is from a breeder, one is a rescue, and they're very, very different.
Mm-hmm. Yeah, of
and
course.
Personality.
I've always gone rescue dogs personally, but they've all come in through work for me, to be fair. So Millie was, she was a 4 or 5 month old puppy. She was in a road traffic accident when she was that age and brought in as a stray. She had some fairly significant orthopedic injuries, so a broken back leg and various things like that. And no one ever came forwards for her. And then my next dog, Bella, was brought into the first practice that I owned as a 7-week-old puppy, and was brought in to be put to sleep. Believe it or not, she had some neurological issues, which meant that she had a head tilt permanently. She had something called nystagmus, which is where the eyes are constantly flickering, and a head tilt. And she was often going round and round in circles.
I remember her very well.
Yeah, she was seen in the park by you guys as well. But she lived a really wholesome life, and again, she's no longer with us, but she lived to the age of 11 years. So from 7 weeks to 11 years was all extra time for her. The 2 dogs that I've got now, I've got a 13-year-old black Labrador called Kia, and Holly, who is a little bit of a handful, shall we say. But she's 3.5, she'll be 4 in December. We got her at 8 months of age, but we're her 4th owners because of her lifestyle choices, shall we say, of not coming back when called and those sorts of things.
Challenging.
Yes, very much so. But she's calmed down now. I guess she's mellowing with her advancing years.
Very good.
Yes.
Our family has discussed they want to adopt a puppy. They have kind of considered their lifestyle. They've chosen the breed that would fit their lifestyle best. What happens next? They come in, register the puppy.
Yep.
What do you recommend after that?
Yeah, so certainly for me, for my whole career really, a puppy health check in the early days, with or without vaccinations. Obviously, we can get to vaccinations in just a second. But a lot of puppies are sold on a puppy contract, which states that it's wise to get them checked over in the first 2 or 3 days of ownership. And I think that's there to protect the breeders as much as giving you peace of mind as well. A general health check would include us doing a nose to tail health check. So looking at their eyes, their ears, having a look at their dentition, so their teeth and their gums, having a feel of all their lymph nodes to make sure they're not enlarged and fighting an infection of some sort, having a good listen to their heart and lungs, a feel of their abdomen, as well as discussing, are they eating and drinking okay? Are their toilet habits all fine? All those good things that we need to talk about in the early days. And also, it's an opportunity, again, to raise any questions that you've got after the first couple of days of ownership. I'm a really big advocate of the family and the pet and the vet practice all working as one unit to advocate for that pet's welfare. So for me, conversation is really important and working together as one unit.
Where do you stand on spay and neutering?
So I am an advocate of castrating the boys and spaying the girls. I think there's definitely discussion to have about the timing of that. And I've been a vet for 23 years now, so things have changed a lot in that time. We used to routinely neuter both males and females, cats and dogs, at around 6 months of age. Now there's a lot more research into the likes of developmental problems, particularly where bone issues are concerned. So osteoarthritis, and also osteosarcoma, bone tumours, and spinal disease, for example, in the Daxies, the sausage dogs with the long spines. Very much a fan of letting the girls have their first season before spaying them, and large breed dogs in particular, getting them to a much older age. So we tend to neuter at about a year of age or more in most cases for dogs, this is. For large breed dogs, so German Shepherds and your Mastiffs and your Great Danes, probably 18 months or older, but just because they've got so much bone development to go through. And testosterone in particular for the boys is involved in that bone development and the final maturation of bone. For cats, slightly different. Again, we used to have this 6-month advice, but now Cats Protection League and RSPCA have given guidance to say it's okay to neuter those a little bit earlier, on the basis that actually it avoids unwanted pregnancies, which for cats is an easy thing to happen, sadly. And we do see cats that are pregnant at 7-8 months of age. So getting in before then can be really useful to control the unwanted cat population. Dare I say such a thing?
Stay with us. We'll be right back.
Join us each week on the Well Beyond Medicine podcast as we explore the 80% of child health impacts that occur outside the doctor's office. Listen and subscribe at nemourswellbeyond.org, where you'll hear pediatric experts, researchers, and policymakers from around the world discussing ways they are revolutionizing children's health. I'm your host, Carol Vassar. Let's go.
Let's go. Well beyond medicine.
So just with everything you just said is already very confusing, because depending on the vet that you speak to, depending on the research you find, it's all very different information. So how does the owner actually then decide the right time for themselves and their pets?
Yeah, and I guess that comes down to a conversation with their vet practice. And, practices will have different protocols and policies in place, but that will hopefully largely be based on the medical evidence that's out there. And it is a somewhat emerging and changing field. Certainly, we've only fairly recently reduced our age on our cats, but we have for a fairly decent length of time, a couple of years or more now, been doing the 12 months and older for the canines, for the dogs. So I think it's a conversation to have. No one will know you and your pet better than your own vet. I can sit here as average vet. I'm absolutely not super vet. I call myself average vet, and give you my opinion and our protocols. But that won't apply if your vet is doing something different. But
Sure.
It's definitely something to chat about.
Yeah. And then what's the conversation you have with your pet owners who decide not to have their animals done?
Quite frankly, that is their choice. And I just ask that it is an informed decision rather than something that we're not even going to consider, and I would ask people to hear the evidence, have the discussion. Quite a lot of people used to historically want their female dog to have a litter, quotation, so that it settles their hormones. And I had a fairly direct answer to that, which is that if we're going to neuter them, well, that's going to settle their hormones because we're taking the source of them away. But the important thing is to get the timing of that right. Do we really want to add to the potential of dogs that are in rescue centres or cats that are in rescue centres when there's no proven benefit to having that litter? If we want to go through the process as a family because we've got kids that understand this and we want to go through it as a process, then that's great. That's really, really good, as long as the animals have been health tested, which is a whole other conversation to have. So things like hip scoring and elbow scoring for Labradors, German Shepherds and other breeds. Some of the Spaniel breeds need to have certain eye tests done. So, and this is, again, back to the backyard breeders and the sort of puppy farms. They don't do any of this because it costs money and all they want is cash. But a family that's going to go through the process with their beloved pet because they want to have this as a family experience, they'll know and hopefully be guided by their own vet practice that, there are some tests and things to do. And I'm all for that. But if people choose not to have them neutered, that's okay. That's their decision, and I would respect that. And I think, pretty much all the vets that I know would also respect that. I just ask them to make it as an informed decision rather than the default.
Sure. Something you just touched on was an eye examination for a dog. So how does that happen?
And so some things need to be done by a BVA accredited eye panel vet, which there aren't many of those around. So that would be persistent retinal atrophy, so PRA, and various other tests like that. So again, reach out to the vet practice. Different breeds, there's lots of guidance on the Kennel Club website actually about breeding and the tests that are involved. So there's lots of reading that people can do if they're thinking of having a litter from their own dog. Go onto the Kennel Club website and there's information there by the bucketful actually about breeding and the tests to do.
Okay. I think we're easing into this question. So why is it so expensive to have your pet seen by a vet?
Yeah, and this is a fairly common query. And another common one is, why is there a consult fee at every appointment? Surely it's the same thing. I'll tackle both of those, actually.
Sure.
I own a practice. It is a business, but I am strongly of the belief that we have to be a compassionate business. And for me personally, the day that I lose the compassion for the job that I'm doing is the day that I need to stop doing that job. You've been a client of mine. Hopefully you saw that firsthand, that, I'm really passionate about the practice that I worked in. I really enjoyed that practice, just down the road from you. They had really good support and so on. The costs of veterinary care they can be high. Even I struggle a little bit at the moment with some of the things that I'm seeing from the corporate world. As an independent practice, our fees tend to be a little bit lower, but we are still a business. We've got our overheads to cover. My practice that I've just opened, the total investment is around £720,000. So, I'd like to have that back within 10 years. And that's before I've even paid myself a salary, and I need to do that. And my team, which, as you mentioned earlier, is a growing team. We're currently a team of 8 people and soon to be 10, hopefully. Things like the X-ray machine, our cost for X-rays is 280 quid for up to 3 images. But we're using a piece of kit that cost me 30 grand to buy. We're using a vet that may be on a salary between 40 and 60,000 quid, a nurse, as well as the other people that have made the appointment, the equipment, the room and everything else. I understand that the fees can be relatively high, but I would sort of say that we take a lot of money, but we do spend nearly all of it. The costs of providing healthcare, be that human, as you probably are aware with your sort of background. Mm-hmm. So human or veterinary healthcare is really expensive. I think we provide amazing value for money, but I do appreciate that the costs can soon mount, particularly if there's a poorly medical case or complex surgery involved.
Do you guide your clients? Do you steer them in the right direction or in a direction for pet insurance?
So the direction I would guide people to is to have pet insurance. I have pet insurance for my dogs and have done for many, many years, even though I'm a vet. It takes away the worry of the financial aspect of treatment. I'm on both sides of this fence. I'm a pet owner and I pay £100 a month per dog for my dog's insurance, which is not an insignificant amount of money. But I know the costs of providing care. So my advice is to have pet insurance. Again, most vets will recommend somebody that they work with, and we certainly do, but there are lots of insurers out there, and it's impossible to know all the ins and outs of all the policies. Have a read, and again, when you're at the point of saying we're thinking of getting a puppy, hopefully your vet would guide you on that one too.
What's your advice to people who, sign of the times, isn't it? So say that there's people that can afford that extra pet insurance, mm-hmm. and they can't afford a vet bill, but they ring you and say, there's something wrong with their dog or their cat or whatever animal they might have. Yeah. What happens in that situation? Because it kind of puts you in a spot, doesn't it?
It does. It affects me. It has a psychological toll on us as a profession when we're in that situation too. And it's easy to say you shouldn't have a dog if you can't afford it. But let's be honest, people get a pet and then their circumstances change 5, 6, 7 years later. We can't say that because actually, what are we really saying there? Are we saying get rid of your pet that you've had for 6 years? Absolutely not. That's not on. Ultimately, I always have a discussion about the treatment options that are available, the pros, the cons, and also the costs of each, and try and come up with at least a plan B. So sometimes it's a case of narrowing the funnel. We've got this whole range of things that we can do, but it may be that the bottom end in terms of cost, I'm saying, well, that's not appropriate because actually there's too many side effects from that product. And at the top end of costs, it may be the client say that's just not doable for us. So then we're in the middle and we can narrow our options and sort of come to a conclusion that hopefully works for everybody. But most of all for the pets, hopefully gets them the help that they need in a timely fashion and makes them feel better.
Where do you stand with vaccines?
My dogs are vaccinated. They always will be. People will make their own decisions. And again, I support that, but I would always ask to have it as a conversation. There's a lot of discussion about vaccines. There is a really common unsubstantiated myth that dogs only need to be vaccinated once every 3 years. So if we can just have 2 or 3 minutes on that, I'd be grateful, because I do want to clear that up. It's really common.
That's one of my questions, so let's go for it.
Cool. I do some webinars and things myself, and I have a little chart that I show people. A vaccine card with the vaccines in it. A puppy, let's talk doggies first of all, a puppy would routinely be vaccinated against distemper, hepatitis, parvovirus, which is the big one that people are aware of, and some form of leptospirosis, which is its own separate conversation too, with or without parrot influenza and kennel cough. Now, a puppy must have 2 doses of all of those. So 2 doses of distemper, hepatitis, parvovirus, and leptospirosis. And those are normally given about 4 weeks apart. There's a little bit of variation depending on the brand of vaccines that are given. Then a year later, so normally about 15 months of age, we need to give a booster, so a repeat vaccination. And that vaccine must again be all of the components, so distemper, hepatitis, parvo, and leptospirosis. For the following 2 years, we can just give, and we do just give, the leptospirosis component. And then at year 3, they need everything again. And the reason for that, and I really wish, because we're doing this on Zoom so I can show you, but obviously our listeners won't see it. The leptospirosis vaccine is a separate bottle of vaccine, and the DHP, distemper, hepatitis, and parvo, is another bottle of vaccine. And we mix the 2 and give it as 1 injection. The difference between the vaccines is that the DHP vaccine, distemper, hepatitis, and parvo, is a live vaccine. And what that means is the virus particles, they're programmed to not cause disease, but they will do other things as normal. So they will invade the relevant cells. The body will recognize that and will give a really strong immune response. The leptospirosis vaccine is a killed vaccine. So those bacteria, so lepto is a bacteria, not a virus, those bacteria are killed, and therefore they can't invoke such a strong immune response as the live vaccine in the other things. So lepto is a killed vaccine. It gives good immunity for a relatively short period of time, but the DHP vaccine is a live vaccine and it gives really good immunity for a prolonged period of time. So lepto will give a maximum of 14 months protection, and that's why we say that they should have an annual vaccination. They don't need everything every year, but they do need something every year, is the way I sort of phrase it. So a 12 monthly checkup, and they will need one or other of the vaccines, or one or both of the vaccines, I guess.
Okay. One of the questions I had that was requested to ask you actually is, since there's no record of rabies in England,
yes,
why do we have to keep giving them a rabies vaccine?
So we don't have to give rabies vaccines in the UK. They have to have it to travel abroad. So my dogs aren't, well, actually my dogs are rabies vaccinated, but they wouldn't have been, except for the fact that I might have been emigrating to Australia had the practice not come to happen. So we don't actually need to vaccinate against rabies in the UK. I can see a day where that may come because of lots of imported dogs coming from overseas and lots of UK-owned dogs travelling overseas. But yeah, we do need to vaccinate if we're looking to travel overseas with them. A lot of people take their dogs to France, Spain, Italy, to the close countries here to the UK. And that's great. As a family experience, it's great. And they do need to have, it's all changed since, dare we say the B word, Brexit. I'm not going to repeat it, don't worry. But since that incident, the UK issued pet passports are no longer, they're not a legal document anymore. You sadly might as well throw them in the bin. And any EU issued pet passports, as a UK registered vet, we're not allowed to add anything to that passport either. So the whole travel process has changed. But I don't know, maybe does the person that asked that, does they maybe take their dog abroad?
They do. So they go to Ireland.
Yeah, okay. So Ireland kind of is its own little entity.
And part of that question, actually, you've touched on. So part of the question, the second part of that question was they end up having to pay for a health certificate, which is quite expensive, and nobody ever checks it when they travel.
Okay. The legal requirement is to have that document in place, and that is what has replaced the pet passport situation or pet passport scheme. The old style was so much easier. We could give a rabies vaccine. We would mark that in a passport document, so same size as a human passport. And there were multiple pages in that document, and each rabies vaccine, each health check, and so on was documented in there. And the UK issued rabies vaccines usually were valid for 3 years. So one vaccine, one passport, 3 years of multiple entry and exits to and from the UK, and you'd have your passport checked and the dog's microchip checked, because that's the way of identifying them. The situation that we don't mention again happened. So we're no longer part of the EU travel scheme because we're no longer in the EU. So the pet passport scheme has gone for UK residents. And therefore, the way it's done now is with the animal health certificate. There's also the AHC, as we call it. There's also an EHC, which is an export health certificate. And the difference between the two is if the owner of the dog is not traveling with them, it has to be the EHC. But if the owner is traveling with them or is reunited within 5 days, it's an AHC. An AHC is easier and cheaper than an EHC. But even the animal health certificate where the owner is traveling with them, it's about a 19-page document. I have one of my vets who does them, and she does an hour of prep work before the appointment, and then it's a 1 hour appointment. So 2 hours of professional time for each journey, because this is the other thing. An AHC has to be done for every single journey because they're only valid for 10 days. We can kind of thank our government for bringing this upon us. Sadly, the vets are just the guys that have to do the paperwork. Fortunately, there's at least 2 hours of professional time involved in each AHC, hence they are sort of, I don't know, up north they're between 150 to 250 pounds. There may be a bit more in the London area because overheads are much higher.
So my friend who posed the question also said that her vet that she's registered with couldn't do the certificate, so they had to go to a vet that was registered to do that, which was a whole different experience because it was with a stranger.
Yes. So yeah, and I guess I'm the same as her vet. So I used to do pet passports. It was a very easy registration and easy registration process. Then it was all taken over by a private company. And so suddenly we went from a £50 3-hour course in how to do it to a £380 a year renewal process because it was outsourced to a private company. And at the time I was a self-employed locum vet, and as a locum, I wouldn't be doing pet passports, but I would have to pay for that revalidation process. So I never revalidated. But as I say, I'm lucky enough in my practice that I have got one vet who does do them. She's kept her validation up. But I know it's kind of 2 hours of work. But the person that asked that question may have a practice maybe with 1 or 2 vets, and neither of them are sort of still validated to do the international travel stuff. And historically, I've sent animals, not personally, I've done the paperwork in order to send animals to Australia, New Zealand, Dubai, as well as loads of passports and things too. It's just things have changed a lot since we know what.
Definitely. And that's one thing that people don't think of.
Correct. Absolutely. There are a lot of people with holiday homes overseas, some of whom may have voted for Brexit, but, realise then, oh, crikey, my house price has fallen over in Spain because the Brits aren't going to Spain quite as much because it's not as easy to go. And sadly, just like that, along with the labour market on the agricultural side of things, there's a lot of European farm workers that came over. It's not as easy to get them anymore. So, and sadly, it's just a consequence of Brexit that we have all these changes that perhaps we didn't realise were coming. But had we have thought about it a little bit more, maybe we would have realised that the EU pet travel scheme won't apply if we're not in the EU.
Another good question would be, each country could have their own procedure. Say that I were to take my dog to Canada.
Yes.
When I'm in Canada, that procedure could be different to what I have to have done here. How does that work?
Yeah. So again, I'm not validated for this. So this is just my own personal musings, I guess, rather than official advice. So the official advice would always be speak to your own vet. And also a lot of the time, vet practices will be saying that the onus is on the owner to find out what they need to do. there are however many countries in the world, we can't possibly know what every single country needs. Historically, I remember sending dogs to Australia and New Zealand, and I lost sleep over those because the paperwork was so intense. I've not had any issues with any of them. They've all been fine. But the worry, the concern, because I know that these people are paying $3,500 for the airfare to get their dog to Australia. And if I don't get the right tick in the right box and the right stamp in the right place, that dog's not on that plane. And I understand how important people's pets are to them as a family. You and I, we're all dog lovers, and I understand the worry and the concern, but I would say we share that worry and concern absolutely with them.
So we're obviously in the travel discussion at the moment, but
Yes.
There's also different rules for different airlines. Different size pets can actually be in the cabin for different airlines. There's so many things to consider. And where would someone go to find all the correct information?
So from the UK side, then it would be the UK government website would give it the relevant information as to what the UK needs. But the authority for the country you're travelling to, so as you obviously mentioned, Canada, so go onto the relevant Canadian government authority website to find out what Canada needs for its entry requirements.
And would you also recommend contacting the airline?
Yes, I would, because they will have their own specific requirements too. So there will be an overarching global agreement, but then there will be variations within that. And also things like different airports have different requirements. So you can only land in certain hot destinations during certain months when temperatures are between, a strictly guided range, just so that animals are not overheating or getting really cold. And I think that's fair. We have a fairly drowsy climate here in the UK. And if we were exporting, I don't know, a Siberian Husky to Dubai, that might not be the best combination. I think those sorts of things need to be thought about. But yeah, there are lots of regulations and suggestions and restrictions, if you like, too, on where and when animals can fly to. So yeah, speaking to the airline, speaking to the country you're leaving, speaking to the country you're traveling to, but also not forgetting, if you're traveling by car down to Italy, you'll be traveling through other countries too. So what are your requirements to enter and then leave the same country, maybe even on the same day? Or it may be that by flight, you might be landing your dog in Dubai, then changing planes to go on to Australia. And again, you need to think about that third country as well.
So it's all very complicated and requires a lot of research.
There are also, yeah, absolutely. And there are also companies that will help with it. But there are companies that can help. So if you just Google, how do I fly my dog from A country to B country, or companies that can help. And they make the process really quite straightforward because they also have their own vets at the airport that can do the final checks. They'd send us or your vet practice a checklist of things to work through. So they do some of the legwork for you, but they do charge for their service. And I think that's fair because they are providing that service and there is a lot of work involved.
It sounds like there is. There's much more than you would typically think about.
Yeah, and it's not just paperwork. There are blood tests and things as well. So for Australia and New Zealand, because they're island nations like us and they're very strict on their biosecurity, they have lots and lots of tests that are needed. And I support that because in the UK, we don't necessarily have that. And we have lots of dogs coming in from other countries and we've accepted leishmania as a disease now in the UK. We never had it before.
Sure.
So lots of tests, lots of paperwork, lots of homework for the humans, I'm afraid.
It is a lot of homework. Let's talk fireworks and anxiety in your little furry friends.
So I'm not sure when this is going to go out, but certainly at the moment, fireworks are not too far away.
Just around the corner.
They are, yes. And great experience for us as humans, but sadly not so good for some of our pets. I think it would be nice to have some restriction on the timing of fireworks. I think once Bonfire Night approaches, we then have Diwali and various other international festivals, which are great, obviously, but it seems that fireworks go on from this time of year right through to New Year now, so we have kind of a third of the year with fireworks on the go. I'm fairly lucky. I live out in the countryside in Cheshire, and obviously having worked in North London, I'm aware that, massively multicultural, which is great.
In London, I call it a fireworks season.
Yes, it is. And it goes on for 4 months of the year, pretty much.
It does.
So what can we do to help? Lots of things that we can do that cost nothing, which is try and manage your own social life so that you're with them. If you need to see your friends, invite them to yours. If they don't have pets, don't go out for a meal. that isn't always appropriate, and why should we put a downer on our own lifestyle choices? But it's a simple thing that we could do, and the things that we can change at home. So making sure the dog or the cat or the rabbit or the hamster has got sufficient safe places to hide if they want to hide, places that are, we can't soundproof the average home, but we can make things better for them. So providing nice deep bedding that they can kind of sink into and they might want to nuzzle into and even bury themselves in, which is great, and that's fine. Playing, not loud, but playing music or playing, having the TV or the radio on is great. Having the curtains closed but the lights on, so that it takes away some of the stark difference between dark and the light of the fireworks. So some background noise, background lighting, plenty of comfortable spaces, feed them early, walk them early. So walk them before it starts to go dark to try and avoid being out and getting caught out with fireworks going off while you're out with them. Every year, sadly, we'll see a number of dogs that have been involved in a road traffic accident because they were being walked, firework went off, spooked them, and sadly, that can be the consequence. Beforehand, so starting now or even earlier than now, there's lots that you can do to try and get them used to the sounds of fireworks. Less easy to get them used to the appearance, because obviously that's, without setting a firework off, it's not going to happen. But there are CDs, there are lots of, there'll be playlists now as well on Spotify and other music platforms where you can play those to get your pet used to the sound of fireworks before they become a reality. So you can start at a low volume and over the course of a few weeks increase the volume so it's not quite such a shock when it happens for real. And then I guess it comes to the likes of nutraceuticals and pharmaceuticals. What can we do as a vet to help you? The first thing I would say is don't overlook all of those other things I've said, because they cost you nothing. We've all got Spotify and other platforms exist.
That's right.
So, look on there for the relevant playlists. But there are lots of things available to help calm anxious and stressed animals. There is a combination of products that I fairly routinely use, and I am going to recommend this. I'm happy to name them if you're happy for me to.
Of course.
They're all over-the-counter products. Most vets, including us, will sell them, but they don't have to be sold by a vet. They're over-the-counter, non-prescription items. Before I mention them, I'll say that everybody that I mentions it to, not everybody, but a lot of people will say, I've tried that and it didn't work. I've tried that one too and it didn't do much. Oh, that one was okay. But these people, when I sort of drill down, they've tried one and then the other and then the other. And my suggestion is to use all three of these products together at the same time in the same pet. And those three products are, there's a product called Zilkene, which is a capsule which you sprinkle onto their food. The ingredient in there, or the active component, is a very specific milk protein. And what that does, it binds to the same receptors in the brain that Valium would bind to. But it's not Valium. It's just a very specific milk protein. And if we think what happens to babies of all species, be it a puppy, a kitten, or a human baby, when they've fed from mum's breast milk, they fall asleep. They're pretty calm and chilled. It's basically having that same sort of effect. So that's one product. Another product is something called Calmade, spelt with a K, which comes as liquids or a liquid or tablet, to be given on the food. And it's a serotonin precursor. So again, back to your medical background, you'll understand the importance of serotonin on mood and anti-anxiety properties and so on. A lot of human antidepressants, or there is a class of human antidepressants called selective serotonin reuptake inhibitors, or SSRIs, and they help the body kind of not waste serotonin because it's really important in mood management and maintaining a sort of balanced mood. Dogs and cats have a slightly different situation. We can't give them SSRIs as routine. There are none that are licensed, but they do build serotonin quite slowly. So if we can add the precursors of serotonin to their food, they will naturally then produce more of it, and it will have a similar impact. And then a third product called Pet Remedy, which is available as a spray, a plug-in. You can get little hand wipes and all sorts of things. And I use we have these plugged in pretty much every room in the consult. We have the plugins in almost every room in the practice, So in all the consult rooms and the kennel rooms and so on. And they are not species specific. They basically, again, they're a valerian compound scent, if you like, and really help with management of sort of anxiety and so on. But I use those three combinations together when we've explored all the other options too. And I have variable results, but largely very, very good results. I remember I was locuming in a practice in Ellesmere Port up in the northwest, and we had a client phone us, and her dog hated fireworks. And I never saw the dog, but I don't need to. They're over-the-counter products, and we had a conversation over the phone. She'd used all 3 products to little success. And I said, but you've used one, then the other, then the other. Try them all together and trust me. And she phoned 2 weeks later and said, that is the best fireworks night we have ever had. And I've had a few clients say that with that combination. I've had others that have said it helped a bit, but it still wasn't great, but yet it took the edge off them. The problem is with psychological issues, which I guess this is, with anxiety and those related senses and situations, it is a very variable feast and very different in different pets. But I think, first thing is to recognize the pets that need support and then go and seek professional help for them. But fireworks and anxiety, and it shows in so many different ways. It can be inappropriate toileting in the house. It can be digging and destructive behavior. It can be howling and barking and, all sorts of things like that. So recognizing that your dog is unhappy in that situation, and then these products, the combination will probably cost 50 or 60 quid, but that's better than a new table or chair leg that they've chewed through or whatever it is that they've done. So definitely try and help them ultimately and seek advice. And again, they're available from big pet stores and so on who may have behaviour specialists that can help you too. So, I'm going to promote my profession and industry, of course, but we're not the only place to go for help on these sorts of matters.
Sure. One thing that I've just recently discovered, because one of my dogs is a rescue, he's come from a past that we're not certain about, but he's definitely anxious about life in general and has separation anxiety, which is something we can probably talk about.
Yeah.
So I've discovered music for dogs. It's on Spotify. It's wherever you get your streaming music.
Yes.
It's missing a decibel that the animal ear misses picking up. We listen to it as humans. It sounds like beautiful classical music. To animals, it sounds a little bit different, apparently. And I have to say, day one of playing that playlist, and we went out for dinner, our rescue dog did not run to the baby gate at the door and claw at the gate. He was happy to stay in the living room on the sofa, and he was quite chilled.
Excellent. And have you noticed that since as well? It wasn't just a one-off event. It's been a recurrent.
So we put it on every time we go out. He still leaves us a little gift when we come home.
Very good of it.
The one interesting fact is we have a doggy cam. He tends to do that the second we close that front door. So it's not like he's needing to go out while we're out. He does it the second we walk out the door.
Okay. Yeah, so separation anxiety is, again, part of the anxiety group, if you like. And there is a specific medication that we can use for separation anxiety. Now, I don't use a lot of that because I do discuss quite a lot of behavioural tricks that we can try to use. So instinct would tell us to make a big fuss of the dog before you're going to go out and make a big fuss of them when you come home. And actually, if we have a separation anxious dog, that's probably the worst thing to do. The best thing to do, if we raise the animal's emotional status by saying, oh, puppy dog, aren't you great? Daddy's going to go now, but we'll be back. We love you lots. Here's a toy. Here's some food. Here's all the bits you love. We're really, really hyper excited. And then 2 minutes later, we've gone. And there's silence. And there's nothing. So we've gone from massively hyper excited and really, really enjoying the attention that the human's giving them and the toys and the treats and the food and everything else to all of that's gone. And there's nothing else there. So they're emotionally really highly charged, then immediately to emotionally nothing. Similarly, when we come home, they're emotionally, hopefully quite stable, sat in the bed, but you know what? There's nothing much going on. Life's a bit boring, but that's okay. To, oh my God, dad's home, mum's home, the kids are home. Again, there's food, there's fusses, there's kisses, there's treats, there's, all these things going on. So genuinely, the best thing to do if we're worried about developing separation anxiety or have a dog with it, in my view, and I'm not a behaviourist, but I'm a vet, and I give this advice quite often with hopefully really good results. Before you go out for at least 5 minutes, but up to 15 minutes, completely ignore the dog. Be at home, but just bring that emotional charge down slightly. And similarly, when you get home from wherever you've been, ignore the dog for the first 5-10 minutes. And it goes against all our instincts. Of course it does. We want to get home, give them a big fuss and give them a kiss and everything else. But actually, we're probably not doing them any favours from a psychological point of view in doing that. Millie was separation anxious. We did those tricks of kind of ignoring her before we go out. And the thing there, and you know, to humanise it, I would like to think the dog thinks, oh, well, Dad's home, but he's dead boring. Well, he's gone out now, so what does it matter? He was boring anyway. And I'd much rather they did that than like, oh my God, Dad's amazing and life's really good and there's all this stuff. And it's just such a massive difference in an emotional charge. Really try and downplay yourself for the first 5 minutes when you get home and the last 10 minutes before you leave. Also, if there are things that trigger their behaviour, so it might be that they recognise that when you put that jacket on, that means you're going out for 6 hours. But when you put that one on, you're only gone for half an hour. Or when you put those shoes on, or when you jangle the keys, or when you lock that cupboard or that door, that means X, Y, and Z. Have a think about your procedure and process before you go out. Are there some initiating factors there that start to make the dog more anxious? Ultimately, the way to get out of that habit is you perhaps still need to do those things. You need to lock that door and move that thing and put those shoes on or whatever. But you can also do those things and then not go anywhere. So it confuses the dog's status as to, well, actually, that usually meant that, but now they're not doing it. So what's that about? You know, that's a basic feature of dog training. Don't reward every time, but also don't sort of emotionally charge them every time either. There are lots of things, again, you know, I'm a big fan of things that cost you nothing. Just change your behaviours before you go out and when you come back. The things that you do before going out, do them at other times too, but then sit there on the sofa with the dog. You know, I'll lock that cupboard, but I'm not going anywhere this time.
Sure.
And it just makes them hopefully not as anxious about that process leading to that event.
We were talking about fireworks. So the same thing happens with thunder. So that was one problem I had with my previous dog. He was scared to death of thunder. So we were recommended a thunder jacket, which I then went online and ordered one that was far less expensive and much more fashionable. But did the same trick. So I highly recommend just ordering a jumper from your online sales, wherever you shop online. And that did the trick for us. I swear by that.
The other thing that people may already have, because from a surgical perspective, we have a lot of people asking us not to have the cone of shame. You know, what other options are there? So there are inflatable collars that are like a car tire around the neck. But also the medical shirts T-shirts that you can have. So it may be that people have already got those sitting around.
I swear by those for our Penelope. When she had her surgery, they look like little pajamas.
Yes.
But they allow her to go out and have a wee and do her business. Yeah. And
much easier for the girls than the boys, though, to be fair, because of where the anatomy lies.
Of course.
So, yeah.
But I swear by that, because in the evenings, if you put that on her, she settles right down.
Yeah. Okay, cool. So Bella, my spinning Labrador, she didn't like fireworks, and she would end up in 3 houses ago. We had built-in wardrobes, and basically that was in the middle of the house, like a 4-bedroom house. That was right in the middle, and she used to end up in the corner of the built-in wardrobes in the main bedroom, just because it was the most shielded from any sound. So we ended up making her a bed in there, and but a thunder jacket helped her too. She wasn't ever brilliant with fireworks, but it took the edge off. It was an improvement. And it's really, she was panting away and just really stressed. And it is really unfair on them, which is why I would like to see fireworks kind of restricted to the night of the event. So, fireworks night, 5th of November, and maybe the Saturday either side or something. There's always calls every year for that, isn't there? But it never seems to get any traction for whatever reason. It's certainly a stress for the dogs.
It's a big stress, and it's a stress for the owners.
Yes, absolutely. Yeah.
You dread all day because you know it's coming.
Yes.
And then it starts. And then there's always that dreaded one-off firework that goes off at midnight.
At 4 in the afternoon, before you're expecting it to. Yeah, exactly. When you're out there early because they're coming from 6:30, 7 o'clock onwards. Yeah.
Yeah. That is just as stressful for us, I think.
Yes, definitely. But yeah, if an animal's having a change to their behaviour, I always suggest looking for chronic low-grade pain. So this is behaviour that, wasn't happening 6 months ago, but is now. And the 3 places I always think about looking, and the 3 places I always check if I've got a behaviour consult in and the people are describing changes in behaviour, are look for toothache. So what are the teeth like? earache, is there an ear infection? Is their hearing affected by that? When you get out of the shower and you've got water in your ear and it's really frustrating. Imagine having an ear infection and you feel 10 times worse than that, and then, be expected to behave like a normal dog at all times. It's not going to happen. And the other thing would be low-grade joint pain. So if it's an older, middle to old age pet, there may be some arthritis that's creeping in. People with arthritis will understand that maybe our tempers are a little bit shorter because we're in pain. The same can be true for our dogs and cats too. So behaviour changes. I always do obviously a full nose to tail exam, but also specifically looking at those 3 areas. And pet dentistry it's a real welfare situation. Toothache is really painful. If you've got an abscess, which is an increasing size structure in a bony case that cannot expand, it really hurts.
And they can't tell you that. Yeah,
exactly. I mean, but sometimes they might tell you in a split second when they go to bite or something like that. And that's what happens sometimes. The dog's bitten the child, but actually the child was hanging off the ear that's really sore, or pulling the lips right by the dental abscess that's there. Dentistry is a really big thing for pet welfare, and it's part of the routine health check that we do as well.
Dogs that are having anxiety with pet grooming.
Yeah.
Pet grooming, bathing,
travel,
all of the above.
Sickness.
Yeah,
absolutely. Again, it's a massively multifactorial thing, and every dog will be different. But again, all of the things I mentioned earlier have on all their data sheets and their info packs that, they're suitable for grooming, they're suitable for travel, they're suitable for fireworks and so on. And, genuinely, I've just had the best response overall by using those 3 products in combination. They're made by different companies. You don't need to buy them from the vet. So I'm not trying to flog anything to anybody, which is a common thing that we get thrown at us. Just go online on Amazon, go to Pets at Home, go to your local independent pet store, go to your vet, go to wherever. But if your dog's struggling with anxiety of any sort over anything, just try those 3 things and, report back. I'd love to know how people get on with them.
Yeah. I know for a fact one of my dogs, I just wouldn't trust with children.
Mm-hmm.
Again, there's no reason why, since he's been our dog, but
yes.
I don't know his past. But that's one thing that I just don't do. So I don't trust him with around children.
And I think that's a sensible approach to have with any new dog meeting any new child. And it might not just be children. You've mentioned the person before is presumably an adult. It could be that it's somebody with learning difficulties or with illnesses. We can't afford for people to have injuries and so on from pets. We get all these stories in the news, don't we? Usually involving large breed animals, but it doesn't.
It's kind of a hot topic right now, isn't it?
It is, absolutely. But it doesn't need to be a large breed. A tiny little chihuahua can cause massive damage. Ultimately, I think it's appropriate to be really on guard with a dog and a young child. Sometimes when there are issues, I don't necessarily think it's always the dog's fault. I think, as I mentioned earlier, if the child is hanging off the dog's ear and the dog has an ear infection, sadly, that was probably going to happen. So sometimes, as the adults in the room, we have to look at where our responsibilities lie as well and make sure that we carry those responsibilities out with due care and attention, I guess.
Definitely.
You're a medical practitioner. You'll have had patients with diabetes, with arthritis, with glaucoma, with Cushing's disease, with Addison's disease, with all these things. And you know what? As a vet treating a totally different species, so have I. Pretty much any disease that humans can get, pets can get too. We know a lot about human illnesses, and the veterinary sector is a long way behind human medicine, but we're catching up massively. Almost any disease that we can get, our pets can get too. These are picking up on these things really early is key to success, which is why doctors now have well-person clinics and blood pressure clinics, and we'll check your cholesterol levels and all these sorts of things. Coming back to why is veterinary care so expensive? We can do all these things too, but the difference is we're not subsidised by taxpayer money, so they sadly do have to be paid for at the time. So I think there's a lot of work to be done in trying to find illnesses sooner, because they probably will cost less in the long run if we find them more early. Kind of older pet diseases, if we talk about cats for a bit, actually, because we've not done much about cats, and they're a massively popular pet. There's a few common illnesses in cats, and one I really enjoy dealing with as a vet is hyperthyroidism. Hyper means overactive, and thyroidism means an overactive thyroid gland. So the thyroid gland is a pair of glands in the neck In humans, it's sort of always depicted as a bow tie shaped structure with a left and right gland. In cats, they are two discrete glands, one on each side of the neck. They can become overactive. In dogs, they get the opposite disease. So I've never had a hyperthyroid dog, and I've never had a hypothyroid cat. But we do get hyperthyroid cats and hypothyroid dogs, and quite a lot of, actually. It's really, really common. The youngest cat I've had with an overactive thyroid gland was 9 years of age, which is relevant when we're talking treatment options, because there are lots of treatment options for hypothyroidism. There is one clinical diet, which I don't use that often because it says even in the data sheets that, like, if you've got a multi-cat household and one of your cats has hyperthyroidism, feed this food to all of them, but then the cats that don't have the disease just need 2 meals a week of normal food. And it's basically a really restricted iodine content in the food. Iodine is needed for the production of thyroid hormone, so if we restrict the amount of iodine, that's obviously going to help the disease process. Another option is radiation therapy, so with radioactive iodine treatment, of which there are quite a few centres in the UK, but the animal needs to be hospitalised for a number of weeks, and all of their waste products, if you like, their wee, their poo, etc., is all considered radioactive. So it's not an overly popular option. It's considered the gold standard treatment method. I'm a fan of surgery to remove the thyroid gland, and it's surgery that I do on a fairly regular basis. We stabilise them first with medications because the disease process itself will usually give a massive uplift in their metabolic rate. So these cats come in really hungry, but losing weight really quickly. It's kind of a disease that I jokingly say I wish I could have just for a month. Become really hungry, but lose a little bit of weight. But no, in all seriousness, these cats come to us like really thin, losing weight, but really hungry. And clearly that's a problem, because if they eat lots of food and don't have an issue, they put weight on. Quite often what I will do is check their heart rate, which is often very quick, and have a feel down the trachea, down the windpipe, and you can often, but not always, feel an enlarged thyroid too. So that's a really common illness in cats. The oldest cat I've operated on was, it was about 12 or 14 years ago now, when animals were not living as long as they are now. But this cat was 17 years old back then, and she had a thyroidectomy that I did. And I had a lovely thank you letter from the client saying that we'd given her a brand new lease of life and she was doing amazingly well. That's a really common hormonal illness of cats. Also diabetes that I mentioned a moment ago, where they can't regulate their blood glucose levels. And so sometimes they'll need to have special diets or insulin injections and so on. Arthritis is really common, and in cats it is so underdiagnosed. Cats are such agile creatures, and we don't really notice when they're struggling with their mobility. Compare that to dogs. We walk them, we're with them, they're on a lead, they're right next to us. Cats live their own life. They climb trees until they no longer climb trees. They sleep on top of the upper level cupboards in the kitchen until they can't get there anymore. But those are the signs to look for. When a cat's life moves from being a vertical life of climbing things and being up and looking down on us, as cats sometimes do, to being a life whereby they're at their lower level beds more often, definitely please speak to your vet about the possibility of osteoarthritis there. And there are some amazing treatments for osteoarthritis, even in cats now. We've always been restricted with cats in some of the drugs that we have, but there are some new products around that are simply amazing with minimal side effects. There's a monthly injection of a monoclonal antibody therapy, which is pretty high-tech stuff, and it targets one of the chemicals that's released by damaged cartilage in the joints, and it simply stops it from transmitting the pain signal. And these cats do amazingly well when they're treated with this stuff, if the diagnosis is correct.
Sure.
There's millions of cats in the UK that have arthritis that are not receiving treatment. So I guess that would be my biggest plea in this podcast, to say, if you're a cat owner, have a look at your cat's lifestyle and look at where they're sleeping now and where they are now. And if they're sleeping at a lower level, they're no longer up on the worktops and they're no longer up on those upper level cupboards, or they're going up the stairs, they're walking up like one step and one leg at a time, please book a vet appointment and get them checked over, because there's so much we can do now.
It's amazing.
And in dogs, there's similar things: osteoarthritis, diabetes, and Cushing's disease, which is fairly common, which is another hormonal illness where they produce too much steroid hormones. Addison's disease is the opposite of that, where they don't produce enough. And I'm sure there'll be listeners to this that maybe know someone with one of these illnesses and think, I didn't know dogs could get that. But they absolutely can, and they do on a regular basis.
My Bruno was treated for Cushing's disease.
Yes.
Yeah.
Bella, my spinning Labrador, was too. And yeah, the signs for that, they often drink more and pee more, and their body shape changes, their skin becomes thin, they may lose hair, no redness of the skin or anything like that, but they might develop bald patches or areas of thinned hair coat. So again, anything that changes should be a cue to go and see the vet. Something's different now to how it was 6 months ago. Please go and get it checked is what I would say there. On the subject of older animals as well, anaesthesia in older pets. Do you mind if I touch on that as well?
No, that's exactly where I'm headed.
Is it? Perfect. Okay. It's like I read your mind, which I didn't, obviously. It's a weird one because quite often clients might think, oh, they're too old for surgery. And I get that. We worry about anaesthetics. We worry about the safety of anaesthesia. But if an animal needs an operation to extend, prolong, or improve its life, in my view, we shouldn't automatically just say no. My own view is that age is not a disease. A disease is a disease. And if an animal has liver or kidney problems or Cushing's or diabetes or all these other things, then fine, we need to look into that and see if that's likely to have an impact. Sometimes it comes down to veterinary surgeon's experience. And again, maybe with my 23 years behind me, I'm perhaps happier in certain circumstances that other vets may or may not be. But again, if it comes down to welfare, and it's a risk-benefit analysis.
And there's a risk for any surgery, isn't there?
Yeah, but I think, and I always do refer to the risk of not doing it as well. We don't take that lump off. Well, there's a risk it is cancerous. We do take it off under an anaesthetic. There's a risk you might not wake up. Reality is in 23 years, I've had 2 animals not wake up from anaesthetic. And I do, 4 ops yesterday, 4 on Thursday. I can't remember, but 10 ops a week I do. And I've done that for 23 years. And I've had 2 animals that haven't woken up. And it is an absolute disaster when that happens. And for that one pet and that one family, the earth is shattered for them. But the statistics are that it happens very, very infrequently.
One of your specialties, which is end-of-life care.
Yeah. I'm going to get a bit emotional here now myself because, it's something that I've helped you guys with as well, I guess. And, and it's
a horrible time of life for us.
Yeah, it is. And I am actually welling up here now. Let's try and be pragmatic. We have the option of euthanasia for pets, and it's an option that we need to very carefully but strongly consider when the time is right. And what I mean by that is when it's the right thing to do for that pet, it's an absolutely rubbish thing to do for us and for the family left behind. But we don't have pets. Well, we do have them for our own enjoyment, but we have them so that they live a great life too. When that life is perhaps not so great and can't be made great again, then we have to consider our options. We probably all know people, and we may have even said ourselves, oh gosh, it's so unfair on that human being having to live through what they're living through. If only there was a way. Well, in a way, our pets kind of have it pretty good here because we can give them a decent end of life. We can give them a good last day. I've done a home visit end of life care appointment today, and the family were absolutely in bits. I understand it. And my practice is called Millie's Vets because of Millie, my first dog, and I get it. I understand the sort of emotional side of this. I guess the sort of phrases that I use, and they may be a bit cliched, but I think they work, is that when it's the right thing to do, it's still the right thing to do. For people that are struggling with this is to see it as the final favour that we can do for the pet. If they're struggling with life and they're not enjoying it, and they're just sleeping all day, or they're not eating, and you've been to the vet and you've discussed the options, and we've had the tests, and we know what it is, and we know they're never going to get better, why make them suffer? Why allow them to suffer? There's a way that we can prevent that from happening. Ultimately, from a sort of scientific point of view, from a procedural point of view, it's an injection of an overdose of an anaesthetic. Yeah. So when we say that we're putting them to sleep, we are literally anaesthetising them to the point of no return and beyond. With my home visits, I routinely would give a sedation first, which is just an injection like any other. And over the course of 5 to 10 minutes, the animal would be pretty sleepy, certainly unable to stand. They just don't know anything from that point onwards. And then the rest of the procedure is to use one of the veins, one of the superficial veins in a front or back leg. And I always use a local anaesthetic spray so that even though they're sedated and they don't really know what's happening, I feel better knowing that I've also put some local anaesthetic spray just on the surface of the skin. And then the final injection, which takes usually seconds to minutes to work. I think to be able to plan for a good final day is, it's golden, really. I was working at the practice down in North London where you guys are when we had to make the decision for Millie. And my bosses were really understanding, and I'd actually helped them with their own dog some months earlier. And I didn't want her to have her final days in North London where she hadn't lived there that long. She was a country girl, and we live in Cheshire. We've got a nice house in the countryside here, and I wanted her to be here for her final weekend. So she went in our kitchen with some chicken McNuggets in her tummy and some chocolate, which is toxic to dogs, but you know what? On the last day, they can have whatever the hell they want.
Exactly.
And she went in the kitchen, in her bed, with Izzy, my other half, holding her, tears streaming down his face, tears streaming down my face. But do you know what? It was the right thing for her. I feel very privileged when anybody, whether I know them or not, contacts me and says, we've heard good things, can you come and attend to our dog, cat, rabbit, guinea pig, hamster, their final time. Was I up north when I came to help you? But
you were. So we had planned Bruno for a few days later than it actually happened, and on the day that I contacted you, we decided it had to be that day. You were, I can't remember if you were working, or I think you were on a day out actually.
Yeah.
And I said, is there any way we can make this happen today? Mm-hmm. And you did. And it was the most beautiful experience, but the most heartbreaking, because I wasn't ready for it. I wasn't ready, but Bruno was ready for it.
Yeah.
And I don't know if we would have got through it had it been a stranger in a clinic. It would have been such a cold. It's that whole driving to the clinic and you're not going to come back with your pet.
And also, how busy is it going to be at the practice? Because again, I'm going to stand up for my colleagues here a little bit. We want to give the best service that we can. And especially in those appointments, we desperately want to do that. But if we've also got 6 other people waiting, there is a time pressure. We understand that and we try and plan for it. But again, because of Brexit affected our workforce and COVID affected the amount of animals that exist, it isn't always possible to give the time that we always want to. It's just a nice way to, if they've got to go, I just think doing it at home without the time pressures, without the waiting room, without the emotion of, maybe paying as well, walking to a front desk and there's 6 other families waiting and doing all of that with eyes on you. I'm not a fan of these things that you sometimes see saying, if this candle's illuminated, a family is...
I was going to mention that.
When you're not the family that's going through that, isn't that lovely that the practice does this? But when you are that family, you come out and all eyes are on you.
Mm-hmm.
And I'm not sure that we want that spotlight.
No.
So my clients, I run a practice. We're a fairly busy practice. I work long hours, but I have made the vow that I will never stop offering home visit end of life care. It's really important to me. I'm a vet. I'm an advocate of animal welfare. It's important to me that the pet and the client, the family, get what they need out of those final moments. If we can't do that bit right, then we kind of need to take a look at ourselves.
Right, for the comfort that we as the pet owners get, and knowing that our pet gets as well.
Yeah. Being
Being able to die at home in the comforts of home was just, money couldn't buy that.
Mm-hmm.
And the one thing that you educated us every step of the way, we had control 100% of the way. You said, I'm not going to do this until you tell me you're ready. We had our time, which was amazing. And the one thing that was very educational for us, and it was a worry of mine, was our second dog.
Mm-hmm.
So a friend of ours had taken our second dog out for a walk during this time. And you explained to us that it was very important that he come back after Bruno had died so that he knows Bruno is gone. And you said I was worried that he was going to be this big ordeal. And you said, no, he's going to come in and take one sniff and he's going to walk away. And it's exactly what he did. That probably broke my heart a little bit, but
Yeah.
it was a nice feeling.
And also, sadly, I've seen the second dog, the second cat situation, sadly, hundreds of times. And it's a really predictable thing. I don't like the other pets to see the process of what we do when we do it.
Sure.
But I am a huge fan and really do recommend that the second pet sees them once they've gone. They knew they were ill. They may have been sleeping differently than they used to. They may have slept in separate beds, but the last 3 weeks, she's gone and got in bed with him, or he's gone and got in bed with him, whatever it may be. They know they're poorly. They know the other dog's poorly. For them to just disappear, I think, may have a sort of psychological toll on them sometimes. They need closure just like we do. And I think allowing them to see the body afterwards, with or without me there, sometimes without me there, if I don't know that family and that pet, I'll step aside and say, well, I've done my bit. I'll disappear to the car. I'll give you 15 minutes together as a family. And if I'm arranging the aftercare, then I'd go in at that point and sort of take the body away. But if I'm not arranging aftercare, I'd just say, well, I'll leave you now.
That was the other beautiful. So that took stress away from us, which is probably, so if someone's going out to a vet that doesn't provide the aftercare, that would be another hugely stressful event for the family. But for us, you said not to worry about anything. You took care of everything. You took Bruno away, and you brought his ashes back when they were ready. And it was just the most beautiful thing. We just had no stress with that aspect. And I think the service that you offer is top notch, and I recommend it 100%.
Thank you. That genuinely does mean a lot. There are other home visit services that exist who will do similar things. I just do it because I think it's the right thing to do. I'm really busy with my practice, but I'm really passionate about this. For me, it's something that I kind of plan my workload at Millie's Vets around the fact that I will do or will offer one home visit end of life appointment each evening. Often there's none booked all week, but the staff know that I will do one any night of the week after work. So we close half an hour earlier than most practices. The reason being, if someone asks for a home visit end of life, yeah, I'll go and do it. That's fine. It's a kind of non-negotiable with us. It's, if someone wants it, it's there, it's done. I mean, I guess the high for me is, like, I've got 2 dogs, you've got 2 dogs, and the pleasure that they bring is just immense. There are reasons to get up in the morning, there are reasons to go out in the pouring rain. To the dogs, we are their everything. And yet, we have so many other things in life, but when we come home from work, there's always a waggy tail. Okay, there's begging for food as well. There might be a chewed chair leg or whatever. But, they love us completely and utterly, unconditionally. And no matter what happens in life, they don't judge, they don't care. They just want to have fusses and food and sleep and rest and love. And that's about it.
And we can have the most amazing life, a human life, and glamour and glitz and you name it. But when you come home at the end of the night and the dogs are wagging their tail when you come through the front door, is better than any of that. I'll have that any day.
Being a vet is not all cute puppies and kittens, but you know what? Sometimes it really is. Sometimes we just have a day of puppies coming through for their vaccines and stuff, and that's just ace, because you can work with the families, and you can see their joy and their enjoyment of what's going on too. And yeah, it's priceless. I love it.
That's amazing. I love that. Thank you very much, James. I really appreciated you taking the time to have this conversation.
It's been my pleasure. I've really enjoyed it, and hope that people find it useful, educational, interesting. Any of the above will suffice as far as I'm concerned.
It's very educational. Thank you very much.
Great. Perfect.
Thanks, James.
Thank you.